Hello, good evening. Hi, sir. Good evening.
Hi, Kevin. Good evening.
Welcome to my page. So, so today is a very important topic. It is about alcohol. Last week I done a talk about addiction, sir. What is addiction? What is,
Okay.
and I'm going to do the coming 2 weeks also other substances, nicotine and cannabis as well. Um, So for everybody who is watching, we have Papara sir with us. He's our chief consultant physician from Kim's Hospital. That's where I'm working from. And sir is one of those few doctors that recognizes the importance of mental health. From the day one that I joined 4 years back, he's been giving me referrals. He promptly identifies all the patients, and he's actually one of the doctors that gives me a lot of referrals. That shows that he believes that physical health and mental health are coexisting, and they impact each other to a very big level. Welcome, sir. Sir, I
Thank
have
you
some
very much.
questions. Yes.
Please
Sir, I
go
have,
ahead.
yes. Sir, I won't take much of your time, just 15, 20 minutes or maximum 30. First question, we all know that alcohol affects liver. Everybody knows this. It's a very layman's thing. Can you shed some light on how it affects liver? Like what happens exactly?
Yeah. As soon as we drink alcohol, it reaches the blood and it goes to literally every organ of the body. And in the liver, particularly, it has a spectrum of diseases. Number one, the milder form of that is called alcoholic liver.
Yeah.
And the second is for the alcoholic, that is infiltration of fat into the hepatocyte, into the liver cells. And addition of inflammation to this is called alcoholic steatohepatitis. And as the spectrum goes on, if the guy continues to take alcohol, the steatohepatitis leads to hepatocellular death, leading to what is called cirrhosis. And many studies shows that steatohepatitis up to 25% of them will go into frank cirrhosis. Eventually, it's just the question of time. So, if the inflammation continues, they can have hepatocellular carcinomas. If they still continue to take alcohol, there will be complete liver damage and they can have hepatic encephalopathy. They can have initially hepatic decompensation, which is denoted by increase in portal pressures and increase in esophageal and gastric varices, and also they can have vomitings of blood and so on. They can have hematemesis. They can have even the hemorrhoids causing profuse bleeding. They can have varices and varicose bleed. This is the usual spectrum. At the end of the spectrum, there is what is called hepatic encephalopathy. Liver fails totally, and then it cannot detoxify the most important neurotransmitters also, like GABA and so on, and thus it causes hepatic encephalopathy. All these toxins get carried to the brain and causing hepatic encephalopathy. So these are the wide range of spectrum. How to recognize this is that one thing is, honestly, the guy has to tell how much he is drinking and how much can affect the liver and so on. In a small study, it can have acute changes, sudden changes in the liver. So when somebody is given 200 to 250 ml of alcohol with a completely normal liver by biopsy, within 16 to 18 days after 200 to 250 ml of alcohol, they found moderate to, moderate fatty infiltration, steatohepatitis, and uh, some parts of liver cell damage. So this is just happened in 16 to 18 days in 20% of these people who had sudden binge of alcohols. That's how the liver affects in a short term. In a long term, I have explained earlier, it causes initially fatty infiltration, then the steatohepatitis leading to cirrhosis, liver cell damage, and then liver starts decompensating in the form of portal hypertension, in the form of varices, and in the form of ultimately hepatic encephalopathy. These are all, spectrum of diseases that the alcohol can cause on the liver.
So that's a lot of diseases in the liver, sir. Also, I think for everyone who isn't understanding like the terminology what sir said, I tell it in a very simple way. Liver first swells up because of fat, then it shrinks, and then it fails. Sir, one more thing is all the patients, when I tell them like you have to stop drinking alcohol, like it's not good for your health, they tell me that my liver function tests are normal.
This is the paradox about the liver disease. Liver disease is very much incipient. Almost 90% of the alcohol takers have some form of liver disease, particularly the alcoholic fatty infiltration, and some have the alcoholic steatohepatitis. And eventually, if they continue to have the alcohol, they continue to have more and more complications. Though the symptoms are incipient, and if you see initially the liver cell test, if you do an ultrasound scan of abdomen, the liver appears normal or mildly enlarged because of the fat. And at this stage, if you do a liver function test, including the liver enzymes, there will be mild elevation of liver enzymes or maybe normal liver enzymes. There will be mild increase in, prothrombin time. There will be mild decrease in albumin, which a normal man's eye cannot go, So normally they go to some laboratory, they get tested and they interpret themselves, seeing that they don't have a liver disease. There are many, parameters that causes severe, mild, moderate liver disease. There are many genetic factors that can influence these disease. And of course, the amount of alcohol will be they drink and the amount. I'm getting calls in between, so I'm declining.
Okay. Yeah, that's right. Yeah.
So of course the amount of alcohol and continuously, if you impinge the liver cell death continuously, if you drink continuously and the liver is not going to recover, you are not giving the time for the liver to recover. So the damage is faster with those regular drinkers. And if intermittent drinkers or social drinkers, or if they give gap adequately so that the liver recovers, for them the net damage is much lesser.
Right. Sir, for people with liver damage, any changes in the diet, sir? Obviously, first thing is abstain from the alcohol, and along with that, any dietary changes to be done?
So, most of the alcoholics will not eat properly. If they eat some food, it is a wrong food most of the times. So most of them will have malnourishment. They don't have adequate vitamins, minerals, and trace elements in their diet. And most of them, with their fascination to alcohol, they neglect the food and their nourishment and so on. So this leads to a lot of, vitamin deficiencies, and there are so many other diseases secondary to vitamin diseases that can happen, particularly with the brain.
Yeah.
So ideally, they are advised to abstain alcohol, number one. Number two, they should take adequate protein because their albumin is low, particularly, at 2 or 3 eggs per day, at least the egg whites will do to support the liver to produce albumin. Liver albumin is only produced by the liver. Around 12 grams it produces. So we have to give adequate, raw material for the liver to produce albumin. So, and high protein diet, these are important, and fresh vegetables, fruits. This, this gives immune boosters. This gives adequate calories. This gives adequate vitamins and a balance of carbohydrates, proteins, and fats. It is more and in Hyderabad, there is a study that people eat about 75% of their food in the form of carbohydrates, whereas world over people eat just 40% of their meal as carbohydrate. So all these factors has a great impact on the liver as well as particularly in those who has alcohol intoxication and alcohol dependence.
Right, right. So somebody just asked a question that the this person's husband had alcohol dependence, and doctor had told to reduce consumption of meat and take little less protein till the liver recovers.
It is true, once the liver has completely damaged, even the protein diet can be hazardous. When the liver is completely damaged, it can still, because protein end products are, some of the nitrogenous products, they cannot be detoxified by the liver and they remain, particularly the end product, one of the end product is ammonia. If it remains in the blood, it can lead to more and more, mental obtundation and hepatic encephalopathy. So this happens in those who has, more than a critical level of liver damage. In those people, one has to be careful about the meat and high protein diet. Otherwise, in a mild to moderate disease, one can have high protein diet even to support the liver.
Right, right. All right. So that's about liver. What about stomach, sir? What's the relation between stomach and alcohol?
Yeah. The alcohol, has a direct impact on it. It goes directly to the stomach, and it can have effect on the esophagus and the stomach and duodenum as well, and the rest of the intestine also. In the esophagus, if they have a persistent vomiting after a binge of alcohol, they can have a disease called Mallory-Weiss tear, which can produce a tear in the lower esophagus and can cause hematemesis. You can have blood vomitings and so on. And it can happen in normal people also, but it's more common among the alcoholics. Number two, in the stomach, it can cause erosive gastritis, erosive multiple erosions and ulcers in the stomach. It can also cause duodenal ulcers. Chronic alcoholism can lead to even duodenal ulcers. So in the acute form, it causes acute gastritis, acute erosive and hemorrhagic gastritis, which can lead to severe hematemesis at times. And usually once they stop and give supportive medication, at this point, they recover. And in a decompensated form of liver disease, they can have portal pressures will be high, which is directly has a connection with the gastric veins, venous plexus, and it can have esophageal varices, most common, and next common is the gastric varices, and they can have rupture of these varices and can cause hematemesis. And next is it can cause altered pH in the lumen of the stomach, and it can cause irritation of the gastric mucosa, and it also can cause spasm of the lower gastric or pyloric sphincter, wherein the alcohol is more comes in contact with the stomach for a long time, particularly after binge drink, it can have more and more deleterious effects as direct effect on the gastric epithelium. It also can cause at some places, particularly in the proximal part of the stomach, where there are, parietal cells, the absorption of vitamin B12 will be depleted, and they can have secondary effects secondary to the B12 deficiencies and so on.
Right. So ulcers are very common. I mean, everybody knows this. Ulcers are very common,
Yeah.
and even the intake of alcohol when someone with ulcers can turn into a gastric carcinoma as well. This is also we are
It's
observing quite a bit.
it's not conclusively proven.
Yeah.
There are definite effects on the hello. Yeah. And
Yeah.
the gastric carcinoma part, like spices, this is not conclusively proven.
Yeah.
But of course, it definitely causes liver, cancers.
Yeah. I mean, back in med school, every disease, literally in internal medicine, had alcohol as a risk factor, along with smoking. Like everything, every organ is affected by alcohol. I used to wonder.
Because once it is drinking, it just goes to every part of the body.
Yeah, true. Sir, I mean, one of the major severe state that people get admitted in our hospital also under you is pancreatitis. So, can you tell people what is pancreatitis? Like, what happens exactly with alcohol?
Yeah. Pancreatitis, alcohol-induced pancreatitis is one of the most common diseases that alcoholics encounter. At least 10% of acute pancreatitis are related to alcoholic consumption. When somebody consumes alcohol, it causes two things. One, it can have a metabolic effect and it can increase the levels of acetaldehyde in the liver, and it can cause accumulation of the bile, and it can sensitize the pancreas to for the cholecystokinin, which is a the bile that is secreted by the liver and stored in the gallbladder. The pancreas gets more and more sensitized. Number one. Number two, it produces more innate enzymes like lipase. It increases the production of lipase. It increases the production of some peptides, which can have an auto effect on the pancreas. It can have a auto digestion effect on the pancreas and thus cause severe inflammatory pancreatitis. So this is very important that one of the most important cause of pancreatitis is binge alcoholism, and if they continue to have alcoholism, they can have even increased secondary diabetes or increased pancreatic cancers as well.
Yeah. So definitely, I mean, so you're saying even diabetics definitely should avoid alcohol because they are at higher risk.
Yeah, at least they should moderate, or they should regulate their intake of alcohol.
Right. So does it have any effect on heart?
Yeah. The heart is much less understood. Actually, people think that it affects the liver. It has a lot of deleterious effects on the heart. There are two types of hearts. One is a broken heart syndrome, happy heart syndrome, with a very intense negative emotion. It can affect the blood pressure. It can affect the cardiac rhythm. It can affect the vagal stimulation, and it can have sudden cardiac arrhythmias and acute coronary problems as well. Other way, that is about the broken heart. Other way, happy heart also. If somebody is overwhelmed with joy, they also can have with more and more immense positive effect They can have the effect on the blood pressure and the cardiac rhythm, and they can have a syndrome called happy heart syndrome. That's for a small percentage, but the real effect on the heart is, as somebody, it affects the indirectly and directly. The indirect effects are by increasing the cholesterol levels. One certain amount of alcohol above the moderation, it causes increase in cholesterol. It causes increase in triglycerides, and it reduces the what is called the HDL, which is a good cholesterol. So it increases bad cholesterol, reduces good cholesterol, and increases the triglycerides as well. This is indirect. But when it comes to direct, it has a direct effect on the heart. So it can cause what is called alcoholic cardiomyopathy. So it can affect the small vessels within the heart, and it can lead to, with a normal blood supply to the heart by the coronary arteries, it can have intrinsic muscle disease. Continuous alcohol consumption can have myocardial cell death. It can dictate myocardial cell death. This is mostly linked to their precision of genes, their genetic coding, particularly DD genome genetic patterns can have a more alcoholic cardiomyopathies. So the alcoholic cardiomyopathy compared to relative regular or idiopathic cardiomyopathy, if they stop alcohol, the reversal rate is better than the regular cardiomyopathy or idiopathic cardiomyopathy. If they continue to consume alcohol despite the adequate signals from the heart that it is refusing, then this is deleterious, this is detrimental. And even a single binge of alcohol can cause myocardial cell damage. Single alcohol of 250 ml of hard liquors, like one drink is called 14 grams of alcohol, which is equivalent to 45 ml of regular whiskey, brandy, or gin or rum, such hard drinks. So if somebody takes binging 200 ml or above of hard spirits, then very next day they can have heavy heart, they can have shortness of breath, they can have muscle cell damage. And if this continues for quite some time, almost 50% of the people who are alcoholics can have their myocardium damaged. Along with myocardial damage, they can have irregular rhythm of the heart. And most common irregular rhythm is the atrial fibrillation, which can lead to abnormal irregular beating of the heart, which can lead to ineffective pumping of the blood, which can also lead to blood gets clotted, and this blood clots will be carried to the brain and elsewhere, which can which cause further damage to the various organs of the body. So that is important. Those who give signal of abnormal cardiac symptoms, and then comes the investigation. Once they come to you or me, we will try to investigate that. They can lead to one, as we told, atrial fibrillation. They can have QT prolongation, and many of the drugs, whichever leads to QT prolongation, can have abnormal ventricular arrhythmias in those. So that is dangerous arrhythmias. Number 3, we have to do what is called imaging. If you do an echocardiogram, if the ejection fraction of the functional ejection fraction goes down, that is imminent that they are going to have the alcoholic cardiomyopathy, and this is the time they have to realize and come out of that. So if this continues to have, if they continue to take, the myocardium will be damaged beyond a critical point which cannot be reversed even you stop taking alcohol. So this is important to take the initial signals. An ECG will show, an echocardiogram will show, a MRI will show, a coronary angiogram will show, even the perfusion tests like radioisotope tests like radiothallium tests will also show the effect of the alcohol on the myocardium and the heart.
Right.
And if they continue to have, majority of them will suffer from heart failure, and they present most of the times with signs and symptoms of heart failure, particularly paroxysmal nocturnal dyspnea. Most common after a binge drink of alcohol. They lie down flat, and in the middle of the night they get up with dyspnea, and they wake up with air hunger. This is one of the commonest presentations with myocardial damage secondary to the alcohol. This is one of the most common secondary cardiomyopathy. Most of these are primary. This is the secondary cardiomyopathy. If we cannot differentiate with these available investigations, we can do a Holter test to check the irregularity of the heart. We can even do a myocardial biopsy or endocardial biopsy to prove that their other diseases are ruled out, and with the history and the cardiomyocyte death, you can tell that this is most likely a alcoholic cardiomyopathy. That's how we ultimately reach at the diagnosis.
Or they can avoid all of this by not drinking.
By not drinking. This, in life we have choice.
Yeah.
Whether you want to suffer and take a pleasure, you want to take a,
Yeah.
In fact, if you want to tell about the benefits, I don't mind, but WHO, many people say that doctors recommend that. There are certain studies, certain background to recommend that in mild to moderation, but WHO recommends alcohol as a recreational drug, not as a health drink.
Yeah.
So it should be never advised by doctors as a health drink. It is just a recreational drug because of its potentiality of the addiction, addiction forming.
Yeah, I tell all my patients, don't drink when you're alone, don't drink when you're sad. That's the first downfall. You will get there. So before
it is a recreational drink. It should be situational. It should suit to the circumstances. It should suit the occasion. Yeah. No, alcohol is it should be within limit, within moderation, with complete social responsibility. Yeah. And social and personal responsibility. This is important.
True. So before I let you go, one last question, sir. That is about alcohol's effect on the reproductive system, on the male and female reproductive system. What can occur?
It can affect from orgasms to organs. So it can affect, it is well said by Shakespeare that it arouses the desire and takes the performance. So alcohol reduces the sexual performance. Alcohol causes small vessel damage and endothelial inflammation increases. It can cause increased oxidation process, and endothelial damage is the first expressed as erectile impotence in case of men. So people will have with alcohol immediately. If they drink too much, they will have, they cannot perform. They can have both erectile as well as, ejaculation problems. Whereas, if they continues to drink alcohol, and there will be inflammation of the endothelium, this is called endothelitis, and endothelial dysfunction. When it happens in the big vessels like cardiac vessel, it takes time. You still have a lot of time. Initially, it causes 30%, 40%, and 50% is a significant cardiovascular disease. Whereas in very small vessels, which supplies to the genital system, particularly the penis, most importantly capillary, we know the mechanism of erection of penis. The capillary dysfunction around that will cause increase immense problems with erection, which is the initial part of the sexual dysfunction. So this is one point. It can reduce the spermatogenesis. It can reduce the sperm count as well as motility among the men. In women also it has its own effects. It can have an effect on the quality of the ovum that they produce. And if they continue to drink without the knowledge of pregnancy, if they continue to drink, they can have a lot of deleterious effects on the fetus. And in the initial form, they can have, particularly when the brain and facial system is evolved, they can have craniofacial abnormalities of the fetus. And in long term, this disease is called, fetal alcohol spectrum diseases. There is a big spectrum. This spectrum goes directly intra-abdominal teratogenicity. They can have more chances to produce tumors, particularly, cranial and craniofacial abnormalities. They can have more chances to have the growth of the fetus may not have big effect on the fetus. They can have small for dates or big for dates as well. The delivery may not have problems, but once they deliver, they can have, fetal or neonatal alcohol syndrome, which is also part of fetal alcohol spectrum diseases. They can have a simple spectrum like memory loss, poor intelligence, cognitive dysfunctions in long term, and they can have, developmental abnormalities and so on. So, somebody while pregnant, while they are in pregnancy, they can transmit the problems to the offspring, and their offspring cannot have, they cannot produce an intelligent and smart offspring as well. So this is important for all pregnant women. When they, particularly, it is easy for the pregnant woman to motivate. Actually, most of the countries, there are many studies that women get motivated easily when they become pregnant, because that is for their offspring, for their fetus, growing baby. So that's important, that they should not give alcohol to their babies who are just forming.
Yeah. All right, sir. Thank you. That was very elaborate. If people think these are so many diseases, sir only spoke about half. There is half more that we are not even getting into because of lack of time. That's. I think there is no main organ that we left other than lungs. There's everything that we covered that is affected by alcohol. Thank you so much.
The whole body is there. Once it enters into the body, it takes care of the body. You have to give your body to the alcohol. As simple as that.
Yeah. True. Thank you so much, sir. You have a good evening. I'll see you at work, sir. Bye.
Thank you very much. Take care. Bye bye.
Bye.
How about the brain and
Yeah, sir left, and sir asked me about what is the relation between brain and alcohol. That I'm going to talk now. I had to let sir go because he's getting a lot of calls, and probably it's still his work time. So alcohol definitely affects brain. There is no prizes for guessing it, because people drink because they want the brain to get affected. They want to feel the high, and they want to feel the euphoria and excitement of it. But just know that there is also a downfall to this. It's just two sides of the coin. The side of the coin that you're not seeing is what we see as doctors. So when the alcohol is causing high and it's giving you good sleep, that's why a lot of people still drink alcohol in old age, because they want to sleep with alcohol. What happens after that is you can go into coma. It can cause respiratory depression. When I say respiratory depression, it's not your mental depression. I'm talking about it suppresses the brain respiratory centers, so you won't be able to take breath. Even though if your lungs are in perfect state, it's still not enough. You will still have respiratory distress, and that can lead to death in the sleep. A lot of people, when they drink a binge drink or a bout of alcohol, when they go to sleep, and morning you hear that they passed away, this could be one of the important reasons. And also, sir has mentioned that sudden cardiac death also can occur. in people who are drinking alcohol. Another thing what alcohol does in the brain is alcohol generally it tends to thicken the blood. It increases the blood thickness, increases the blood viscosity. So it causes it forms a lot of clots in the heart and in the brain. When these clots are formed in the brain, what happens is it causes a condition called stroke. Stroke is what you all probably have heard of as paralysis. Me and Dr. Jaiswal had discussed in the past how alcohol is one of the important risk factor for people with strokes. That's why anybody who had stroke, to avoid the recurrence, we usually tell patients to please avoid alcohol. If you think you can't moderate it, just avoid alcohol. That's the best way. Otherwise, strokes can occur recurrent. Along with this, what else can occur in alcohol is that below the brain there is a small brain called as cerebellum. Cerebellum is required for you to maintain the balance. If I'm walking straight, if I'm maintaining my posture while I'm sitting like this, it's completely because of my small brain called cerebellum. When I'm drinking alcohol, alcohol affects the cerebellum. It's called as cerebellar degeneration. So that's why you see people who drink alcohol, they won't be able to walk straight. They're always swaying from side to side. That you think that it's only in the night. By morning when the high goes off, when I get up, it's going to be fine. One day it's not going to be fine because the cerebellum must have got damaged and there is no way you can maintain the gait anymore. Even when I'm not drinking, just because my alcohol affected my cerebellum, I could still be walking, swaying all through my life. That is one more important thing that can occur. Now, some of the people drink alcohol not because of the pleasure, but to avoid the displeasure caused by stopping alcohol suddenly. Yes, when you stop alcohol suddenly, what happens is it pushes you into a state called as withdrawal state. Withdrawal state could be very dangerous. It can cause death. It can cause seizures. Seizures are nothing but fits. A lot of people keep saying that, oh, he had fits like 5 years back once when he stopped alcohol because he was going to Shabrimala, or, he was on some god's thing. So when seizures occur, that's a clear indication that alcohol had really like affected your brain. That is one of the important things, and it can push you into a state called as delirium. Delirium is a mental health condition where you have a lot of hallucinations, delusions. You won't be able to sleep. Your body is trembling. You have a lot of mood disturbances. You're feeling irritable. You're having a lot of anxiety, etc., etc., etc. That is called as delirium. It can push the patient into that state also. Along with this, alcohol affects your peripheral nerves, your spinal cord also. When I'm saying peripheral nerves, it causes alcohol neuropathy. Alcohol neuropathy is where, I'm sure a lot of, old people in the house might be telling that, I'm having body pains, or I'm having back pain, I'm having neck pain, or I'm feeling like my feet and hands are becoming very hot. I feel like they're burning or they're pricking. They always feel like there are pins and needles. Someone is pricking my hands and legs with pins and needles. All this is because there is a layer called myelin sheath covering your nerve. It's almost like I'm wearing clothes. Myelin sheath is something like that. Alcohol basically burns that myelin sheath and it damages it completely. So what happens? The nerve impulses won't be generated or transmitted properly. So what is the function of nerves? When I touch you, that's a sensation. But imagine the nerve sheath or nerve layer is damaged. If I'm touching you, you're not knowing the sensation, but you're having too much of sensation or too little of sensation. Both are problem. If you have too much of sensation, you're always feeling like you're having electric shock. That kind of sensation occur. Or if you're having too little of sensation, you can see in diabetics who don't have sensation, they're always having a lot of injuries on their feet, and that leads to gangrene, and then doctor have to like cut and remove the feet. All this can occur because of alcohol. It can cause encephalopathy. It can cause Wernicke's psychosis. I don't want to get into the technical names what alcohol can cause. Just understand that there is no area of your body that is not affected by alcohol. If you want, you can give me an organ saying that's what my intro of the talk said to. Give me an organ, I'll tell you what alcohol does to that. Beyond all this, just understand at a very beginning level, it affects the relationships. It affects your own role in the family. It displaces your position as head of the family. How a lot of people are dying because of alcohol, and a lot of women are suffering because of domestic violence caused by alcoholic spouses. Just understand all of this. And also, little one extra line I want to add before I go is in women. Alcohol affects women even more than it affects men. I'm not saying that men can drink but women can't, but what I'm saying is studies have shown that alcohol affects women even more because alcohol affects their damages their uterus. So they'll have a lot of menstrual disturbances and they can have spontaneous abortions. And they can have, as sir mentioned, fetal alcohol syndrome, which is nothing but whatever you're drinking that affects your baby. Don't think that you can drink now and suddenly when you become pregnant, you can stop it and nothing will happen to the child. Your body is not, it's not cross-sectional, it's longitudinal. For example, if I drink something today, the effect is not just going to be present for today, it's going to be present for quite some time. So in that case, you can have spontaneous abortions of your child, even after the child is born. Worse is not the abortion, worse is when the child is born with um, mental retardation. You see how some of the children's brain is not developed. They always behave like small children in the family. That's called mental retardation. It's called intellectual disability. That can occur in children who are born to women who are drinking alcohol. So there are multiple effects of alcohol on our human body. So um, I just did this talk because people think it just affects your liver and that's it, and they get their liver function test done from one of the peripheral laboratories without attaching to a hospital, and they see the liver function tests are normal in reference values, and they say that, oh, my liver is fine, I'm fine, I'm not addicted, my liver is not damaged, I'm all great. That's not the case at all. Sometimes with the liver being severely damaged, you can still have your liver function test normal, as sir mentioned in the beginning of the talk. So this is the choice that you have to make about your life. It's a recreational drug. It's a widely available drug. It's a gateway drug. For when I say gateway drug, you start into other drugs starting with alcohol. It's a gateway that leads you into that world of addiction. So be very careful of what choices you're making, how much you are drinking, what occasion are you drinking, with whom are you drinking, all this. The treatment of this is definitely please see a psychiatrist, because initially to prevent the withdrawal phase, we have to treat you medically. That's called as detoxification, following which we'll send you to a rehabilitation center or counselor who is going to counsel you about alcohol, abstinence. There are even medicines that will help you reduce your cravings towards alcohol. All this definitely we can definitely help. So please see a doctor, even if you think that your alcohol is becoming a problem, which is usually a very late realization for a lot of you. But I hope this talk let you understand that how to take care of my own body and what are the things that I am actually buying and getting. Some diseases come because of fate, like you have no say in it, and diseases of alcohol, they don't come because of fate, they only come because of your own doing. So just be watchful. mm. And for all the people who think that I can stop alcohol on my own, it's very difficult. Just acknowledge that it's a problem, it is a disease, and it's beyond your control. You have to seek help. So having insight into your illness is the first step for you to get better. So I think that's all you need to understand for today. So this is a small series that I'm doing for for this month, where I started with addiction. Today is about alcohol. Next coming weeks is going to be about smoking, and then we're going to talk about cannabis as well, which is very popularly called as weed. So I want all of you to check out and understand what actually these drugs do to our body and brain. Um, Thank you so much for tuning in. See you next Wednesday. Take care.